The purpose of this podcast is to educate and inform. It is no substitute for professional care by your doctor or your qualified healthcare professional. Never disregard or delay professional medical advice because of something you've heard on this podcast or in any linked material. Guests who speak on this podcast express their own opinions, experience, and conclusions. Dr. Shirley neither endorses nor opposes any particular opinion discussed on this podcast. The views expressed on this podcast have no relation to those of any academic, hospital, practice, institution, or other entity with which Dr. Shirley may be affiliated.
Welcome to Forever Fab, the podcast on fashion, the art of living, and all things beauty. This podcast is curated by Dr. Shirley Madhere, MD, as the definitive source of holistic wellness through beauty.
This week's episode of 15 Minutes of Fab on the Forever Fab podcast is dedicated to building yourself up. The title of this week's episode of 15 Minutes of Fab is Pep Talk. Let's talk about peptides. Everybody is talking about peptides these days. I've even had patients inquire about them and whether they'll help with some of the common pains many of us, if not all of us, are facing in society, including, but certainly not limited to, weight gain, hormonal shifts, sports injury, memory loss, reduced cognitive function, and aging, among many others. This episode of 15 Minutes of Fab will serve as a basic primer about peptides and how they can be used. I'm hoping that at the end of this episode, you'll have a basic understanding of what they are, so that you may have an informed discussion with your healthcare provider to determine whether or not peptides can help you. Firstly, what is a peptide? Well, have you heard of insulin, the treatment for diabetes? That's a peptide. Have you heard of semaglutide or GLP-1? Of course you have. That's a peptide. Have you heard of creatine for enhanced athletic performance? That's a peptide. And I'm sure, especially on this podcast, you've heard of skincare ingredients such as collagen and copper. They are used as peptides in skincare. And remember argireline, also known as quote unquote Botox in a bottle? Its chemical name is acetyl hexapeptidate. And yes, it's a peptide. Now that you know a few peptides that are in common use, what exactly is a peptide? A peptide is a short chain or combination of two or more of its building blocks, amino acids. Amino acids are the building blocks of peptides, and two or more amino acids form a peptide. Peptides are the building blocks or coalescence of proteins. So when multiple peptides are linked together, they form polypeptides, which when assembled together, they form complex proteins. And we all know about proteins. Peptides are naturally made and found in the body. They perform a variety of critical functions such as hormone regulation, metabolism. They're involved in immune support and cell-to-cell signaling. They're involved in tissue repair, metabolic support, and promotion of muscle growth, and of course in skin health. Peptides are also naturally found in certain foods, such as in animal-based sources as dairy, milk, cheese, and yogurt, for example, eggs, fish, meat, such as beef, chicken, and pork, and shellfish, particularly shrimp and scallops. For plant-based sources of peptides, look to legumes such as beans, lentils, peas, and chickpeas, soy products such as tofu and tempeh, seeds including flaxseed and hemp seeds, grains and cereals such as oats and wheat, and there are also some other sources of peptides that have been that include fruits, vegetables, and certain mushrooms, actually. So, peptides function throughout the body naturally. However, there are also a number of peptides that are manufactured as drugs, also known as peptide drugs. And some of those include Wegovy and Ozempic, and so many others within that class and outside of that class. According to WebMD Online, quote, peptide drugs may have some advantages over other drugs because they may be easier to send where they need to go in the body, have fewer side effects, be safer because when your body breaks them down, their byproducts are amino acids that your body can always recycle, end quote. In general, peptides work by targeting a specific pathway and then triggering a series of chemical reactions that then facilitate the functions I mentioned above. The peptide issue of the Eudaimonia newsletter stated that peptides, quote, don't override biology, they tune in. They remind your cells how to do things they already know how to do, but may have forgotten or gotten sluggish about, due to aging, stress, or damage. And when you use peptides therapeutically, you're often just supplementing what your body would be making if it were younger, healthier, or less stressed, end quote. Sounds promising, right? Some peptides have been used since the 1900s. In fact, the first peptide drug was approved by the FDA in 2001. Insulin came onto the market in 1920s. Even semaglutide of the GLP-1 weight loss drugs was approved in 2005. Science, researchers, supplement brands, they're all diving deeper and searching wider for new peptides that may help with a wish list of popular desires such as weight loss, longevity, hair growth, radiant, wrinkle-free skin, mental clarity, improved recovery from injury, enhanced athletic performance, hormone balance, and sexual health. Peptides used for these effects may be considered as functional medicine peptides, according to Rob Corso, who penned the Eudaimonia piece on peptides. Okay, so far, sounds good, right? Sign me up with caution. What are the names of some of these manufactured peptides? How are you going to know what's a peptide, what's a peptide drug, or, what is some other supplement or skincare that you may be taking or applying? According to an NIH scientific paper by Pentia and his co-authors, some of the more highly sought-after peptides being researched to slow skin aging include Matrixyl, Biopeptide CL, Perfection Peptide P7, my personal favorite, KP1, CUGHK, Argireline, SNAP8, and so many more. Now, other peptides include CJC 1295 for fat loss and muscle growth, AOD 9604 for fat loss, BPC 157 for wound healing, muscle growth, and cellular regeneration, TB 500 for inflammation and tissue repair, and Dihexa for improved cognitive function. It's not going to be easy to remember all of these peptides because there's so many more than the few that I've just listed. So essentially, you really need a reliable professional to be able to help sort through the plethora of peptides that exist, that are currently being researched, that are in the pipeline and have yet to come out, because you may not need more than one of them, if any at all. So how are these peptides used? Most of these peptides are administered as injections, once or twice weekly, once monthly, whatever. It depends on the peptide. But there are also a few that may be taken as supplements, and even a few that may be applied as a nasal spray or topically as a skin patch. Now, clearly, the most traditional route is the injectable route because that tends to be more direct, get into the bloodstream faster, more reliable, and probably more effective. Because anything that has to be taken orally doesn't really necessarily deliver the optimum potency because some of it gets broken down into the stomach. Anything that has to be applied topically can have variable and probably unreliable skin absorption because, again, you're sweating, you're putting on a patch, it may be removed, it may be half on, half off, etc. But again, depending on the peptide and its use, this would have to be discussed with a professional. And speaking of discussing with a professional, where does one obtain such peptides? The most reputable and safest method is to work with a physician who may prescribe the peptides in a responsible way. This includes a functional medicine physician, a physician or surgeon in the field of anti-aging or age management, or licensed practitioners at regenerative medicine clinics. Now, there may certainly be other reliable practitioners, but the ones that I just mentioned are probably the most traditionally reliable. Of course, things that are in demand sometimes create a black market. Please avoid that. How much does peptide therapy cost? It varies. It depends on so many factors, but generally from a minimum of $200 a month up to $1,500 or more a month. Again, it depends on the type of peptide, the frequency of use, whether you're using one single peptide or a combination of peptides, how often, for what reasons, for what purposes, etc. As with all promising but unproven innovations, of course, be cautious. Yes, peptides almost sound too good to be true, at least to me. Part of me is excited, part of me is, leery. There are a lot of shady sellers out there. More research and definitely more clinical experience are needed. So consult with a licensed professional who prescribes from accredited pharmacies. Do your research, get the information, and talk to your doctor. This concludes this episode of 15 Minutes of Fab on the Forever Fab podcast. Thank you for listening, and until next time, stay beautiful and forever fabulous inside and out.
Thank you for listening to this week's episode of Forever Fab, the podcast on fashion, the art of living, and all things beauty, curated by Dr. Shirley Madhere, MD. Live beautifully and help make the world a more beautiful place.